Hello, everyone. Welcome to today's episode. Hello, Dr. Eke. Welcome to the show.
Hello. Hi, everyone. It's nice to be here. I'm very excited. And
Yes,
thank
sir.
God for this opportunity to talk about something I'm very passionate about.
Wow. Thank you so much for coming. I mean, it's such an honor to have you. You look very good, by the way. You look very good. Thank you.
Thank
Thank
you.
you for
Thank you so
yeah.
much.
God bless you.
Mm.
Bless you.
God bless you.
Now, Dr. Eke, we're talking about today something that is very personal. You say you're passionate about it, something that is personal to people because of the journey, because of the impact on both physical health, mental health, social well-being, and all that. Because this been a journey of personal struggle for many people. Okay, so we're talking about infertility, the medicine and the mystery. You see, I'm just going to read in the Bible, Romans chapter 4, 19 and 20. The Bible says, and not being weak in faith, he did not consider his own body already dead. The Bible was talking about Abraham here. He says, since he was already about 100 years old and the deadness of Sarah's womb, he did not waver the promise of God through unbelief, but was strengthened in faith, giving glory to God. No. This was Abraham, and it's a classic example how that he waited for a long time when it was near impossible, even impossible, but God came through for him. You see, so that brings some form of hope. And he said, Dr. Ike, I'm inviting you to talk about this because you're an expert in this field, and obviously you know better. You're a specialist here. I want us to elaborate, to throw light on this topic of infertility, looking at the science first. What are the causes? What is the hope? What hope can medicine offer? And then, of course, we'll tie it up to spirituality and how just try and help somebody and give hope to somebody if possible. Here's how we'll start the conversation tonight. Now, I read in the World Health Organization, their statistics. Yeah, I was really surprised at it. They said millions of people at some point in their life will experience fertility. They gave a statistics. Say 1 in every 6 persons would experience infertility sometime in their life. I thought, is this really true? You see, but that's what's in their website. Okay, I want to start the conversation this way. How would you define infertility? Now, there are people listening to us, but some of them are not doctors. They're just people, Christians, they're just lay people who don't understand the concepts, the science, the definitions, and so I want us to be as simple as possible. How would you define infertility?
Thank you, Dr. Mena. So, again, welcome everyone to this session. Infertility can be defined as the inability, meaning that the couple is unable to be pregnant. So the inability of a couple. So when we talk about couples, we mean a man and a woman. The inability of a couple to conceive, which just means to become pregnant, after 1 year of regular, meaning that, and I will define what regular means.
Okay.
Unprotected, meaning that you're not using contraception, you're not using condoms or anything like that. You're meeting each other the way God created you. Regular, unprotected sexual intercourse. Okay? Meaning that the man and the woman meeting regularly. Regular in this case means at least about 3 times during your ovulatory period, right? So I come back. Infertility is defined as the inability of a couple. So the couple cannot get pregnant after 1 year of regular, meaning that you're doing it 3 times a week, about that, around your ovulation. It's not every time in your cycle. Unprotected sexual intercourse. Now, that definition can be tweaked a little bit. It's age dependent. If you're above, let's say 40, we're not going to be relying on 1 year anymore. We'll be talking about 6 months, right? And sometimes it can even change to almost immediate. For example, somebody who has erectile dysfunction, meaning that the penis cannot stand erect. That person will not wait for 6 months because there is a problem from the outset.
From the beginning.
So that kind of person, you're not waiting for 6 months, you're not waiting for 1 year, you're starting immediately to begin to seek help. So that is basically how infertility is defined.
Mm. Thank you so much. I mean, that's really informative. I learned something from it. Like you're talking about, is 12 months, a 1 year period of regular unprotected sex. Now, and you've defined what regularity means. Is did you say 3 times around the ovulatory period? Is it 3 times a week or 3 times within that ovulation period?
About 3 times
3 times, yeah,
around that ovulatory period.
around that. Yeah.
Yes.
So my next question then will be: how do they know? How do we know what the ovulation period is?
Good. There are various ways to determine ovulation. Categorically, they are classified into two broad ways. One is natural things you will feel. The second is using a test. So let's start with the natural. So a woman knows when she's around her cycle by a few things. One, women usually have clear cervical mucus. Okay. I mean, it doesn't have an infection, just natural cycle. When she's around her ovulation, she begins to have increased amount of clear, watery discharge. And that discharge is usually, it doesn't smell, it's clear, it's thin, it's not thick. Okay. So when you see that, when it changes to that quantity and that quality, you know you're ovulating. Secondly, some women will feel tenderness and fullness in their breasts. And some people will feel it. They'll just feel, tired, drowsy. These are a few things that will tell you that you are in your ovulation. And those of you that ovulate, you know. When you start feeling these things, you know. The problem with using the natural cycle, though, is that you cannot always tell, because you can tell around when it happens, but you cannot tell the exact day when you ovulate, right? Or some people can use their days, right? So let's say you have a regular 28-day cycle. So on day 14 is when you think you would ovulate, assuming everything is fine. You're not stressed, you don't have an infection, everything is intact. So if you know the day you started your ovulation, your menstrual period, 14 days from then, you would ovulate. But that is also very notoriously inaccurate, because people go through stress, people have weight changes, a lot of things can affect that. So that brings me to the third way of doing it, which is the most accurate and the way we recommend you doing it, is to use ovulation test kits. And there are many of them around. You can just walk into, for those of you for people who live abroad, you can just walk into a shop or a store where they sell this and just ask for ovulation kits. People in Africa also, I'm sure many people have this in shopping malls right now. Just ask for ovulation kits and they'll give it to you, and it's very self-explanatory. You just use it and it will tell you, it shows you there are various types out there. Some will start with smiley faces, and then on the day of ovulation it will change from red to green, and there are various ways. So just read whichever one you're using, read the instructions and just follow it, and it will tell you the exact date you ovulate. Now that is important, because like I said, you want to meet your partner around that period. So ideally, a day or two before, on the day of, and a day or two after. So that way you maximize that period. Yes. So if you do that every month for 6 months to a year, and you don't become pregnant, then you have infertility.
That is the problem. Yeah, I think this is very important, because I know there's some couple that they for some reason they walk away, and then they're only around for a few days, and then the woman travels again and stuff, and then after a year there's no pregnancy, and then it becomes a problem. But you see, they've not maximized the chance of giving birth. That's why you give a 12 months period, hopefully targeting that period like you're saying. Now, what is the significance of this ovulation? Because what is happening during this period, and why is it important that this happens around it?
Yes,
if you don't mind me asking.
Very, very good question. So it's important it happens around ovulation, because infertility or copulation or conception is a journey of two people, the man and the woman, right? And so even if the man meets the woman around a time that is not when she ovulates, the sperm is there, but the egg is not there. And so the sperm can stay there, and then after a few days will die off. Now, on the average, the sperm lives for about 24 hours after it's released, which it's not usually the case for the egg. The egg can last for a bit longer, right? So when that happens, when the sperm is released, If it's not around the peri-ovulatory period, then it will not lead to pregnancy. So you want to make sure that you do it at the time around the time of ovulation, so that as the sperm is being released, it meets the
eggs. There's an egg too, yeah.
And then the two can meet and then begin to develop. So that's why it should be done around that period.
Okay, so that means ovulation is when the eggs are released, so that there will be availability to meet the sperm. I think that's really, really informative what you said there. You see, and I'm sure it's bringing some clarity to this concept, and also allaying some anxiety, because some couple after 3 months they're already panicking, and if you put yourself under that emotional stress, it can cause some imbalance and even affect you. So we're going to talk about that at some point in this conversation. Now, I want you to. What is primary infertility and what is secondary infertility? Because I understand there's such a thing.
Yes.
You see.
So anytime you hear primary, the way I teach my kids or anybody who is new into the field, once you hear primary, it means from scratch, right? And then secondary means something has already happened. You're trying to add to that, right? So let's use that as a concept. So primary infertility means that person or that couple have never had a kid before or never been pregnant before, right? More so for the woman, because usually when we use that word, it's more for the woman, but it's now for a couple, right? So primary infertility is when the couple has not had a pregnancy before. That is primary infertility. Secondary, on the other hand, you're trying to add to something, is you already had one before. You've been pregnant before, whether it's you carried it to term or not. But at least you've been pregnant before, confirmed, not just by science, but confirmed by a blood test and or ultrasound, right? Saw that you were pregnant, and then after that pregnancy, after 1, 2, or 3 more pregnancies, you cannot be pregnant anymore. That is called secondary infertility. So that is how you distinguish both of them.
Okay, that's right. Thank you so much. That's very, very, very clear. Now, my next question for you will be: what are the causes of infertility? Now, there's a myth around this. There's some schools, sort of believe that, particularly in Africa, they think infertility is a problem of the woman alone. So the men don't even go for medical check. They don't care about that. It's just a blame game for the woman, thinking it's the woman. And unfortunately, many women carry this burden, thinking it's their fault alone. What are the causes of infertility?
Perfect. This is a very loaded question, and I will try as much as possible to distill the answer in a way that will be very understandable. Now, infertility, like I said, is a problem, and like you rightly said, it's a 50-50 problem. Half of the problem usually will come from a man, and half will come from a woman. So it's a shared problem, right? Now, let's start with the woman. When you look at the female reproductive system, infertility can happen at any point in that female structure, right? So we start with the ovaries, then the fallopian tubes, then the uterus, then the cervix. Those are the organs within her pelvis. But we also know that those organs within her pelvis, or around where she usually will give birth for people who are not in the medical field, there are also other organs that control the ovaries and the uterus. Most importantly are in the brain. So we know that the brain controls everything we do. So the same way the brain controls the ovary and the uterus. And there's a place in the brain called the hypothalamus. That area controls production of milk and other hormones which can affect the female cycle. So let's start with the causes. The biggest, commonest reason why women don't get pregnant over the world, across the world, is ovulatory disorders. So things that have to do with ovulation. Remember I talked about ovulation, right? When you release your egg and things you feel. Some people don't release that egg, and there are several reasons why they cannot release the egg. I'll just list a few of them. Some of them, whether you believe it or not, weight. People become big, right? when people increase their weight increase can actually affect ovulation. The more weight you add as a woman, the less your chances of ovulating. Which is why one of the first ways we try to counsel people who are trying to get pregnant is just look at that couple and see. If that woman is big, the first advice you give her is, ma'am, try and lose weight. And if she loses about 5 to 10% alone, that alone is a bigger ovulation, right? So weight on this end, very big, on this other end, very, very small. When you are very, very slim and your weight is below, let's say below 20, you also risk not getting pregnant as well, because your clock also begins to regulate and ovulation gets distorted. And so extremes of weight leads to ovulatory dysfunction. Stress, you don't rest, right? Stress will turn your clock upside down, and you need a normal clock for your ovaries to be released. So a lot of stress can affect that, okay? And then there's something called PCOS, polycystic ovarian syndrome. It's a disease of the ovaries where the ovaries has a lot of cysts, fluid in them. And when they do that, it cements the ovary and prevents the ovary from releasing eggs. And when that happens, the woman cannot get pregnant. Other things, the thyroid gland. The thyroid gland, believe it or not, affects the ovary function, okay? So when the thyroid gland is not functioning well, either excessively, what we call hyperthyroidism, or reduced function, what we call hypothyroidism, those things affect the ovaries. So that is one of the easiest things to treat, actually. Once you treat that thyroid disorder, the woman begins to ovulate. And then the last one I'll mention in that group is hyperprolactinemia. Some women, when they are not yet pregnant, they'll be releasing milk from their breasts. That is called prolactin. They have a lot of prolactin in them. So that alone, if you have that and you cannot get pregnant, that might be the reason. It's because I talked of the brain, right? So that hormone is released from the brain, and then it produces milk. And that milk production, it tricks your body into thinking that you are breastfeeding. Remember that breastfeeding and pregnancy, they don't go together, right? Yeah. So it tricks your body to think that you're pregnant, you're breastfeeding, and therefore your ovulation knocks out. So for you to begin to ovulate again, you need to knock out the hormone that is making you breastfeed or reduce milk so you can ovulate. So that is ovulatory. We now go into the tube. That is the commonest reason why women don't get pregnant in Africa. Okay?
The tubes, yeah. Okay.
The tubes get blocked. And the commonest reason why the tubes get blocked is because of infection. Infection. Okay?
So that's the PID, isn't it?
PID. Gonorrhea, chlamydia, it causes something called pelvic inflammatory disease, PID, right? The tubes get blocked, and once the tube gets blocked, the egg cannot come down to meet the sperm so that it can fertilize, and so pregnancy will not occur. Okay? So tubal blockage can also occur from other things, like when infection happens in the pelvis, it can actually occlude the tube from outside and can lead to obstruction. And then finally, if it can also occur from fibroids. If the fibroids block the tubes, so fibroids can be so big that they block the tubes. That's one of the ways in which we treat infertility. Is we take out the fibroids if they are blocking both tubes, and that way you can get pregnant. Other things, age, just by getting old. When I mean old, I mean above, 40. But above 35, the egg quality begins to go down, right? And then once you get to 40, it goes down so drastically that just by being 40, 41, 42 and above, alone, without any other issues, it might be difficult to get pregnant because the egg quality declines a lot. I talked about fibroids. Fibroids is also a big one. There's something called endometriosis. It's when the endometrial tissue is found outside of the uterine cavity. It can cause infertility. So that is, in a nutshell, the things that could cause infertility in the woman. In the man, on the other hand, there are, same way we have the testes, we have the tube that connects the testis to the penis called the vas deferens. Then it passes through something called the prostate gland, which helps release juice to the sperm and then the penis itself. So any obstruction along that path would, the same way it causes an obstruction in the woman, you have infertility from that. What's the commonest reason? Infection, gonorrhea, chlamydia, right? Those things will block the penis or the path of the sperm and can lead to infertility. Other things, something called varicocele. Some men would see that their testicles is like a bag of worm. That is a problem. If you have that, make sure you see your doctor, because that may be the reason why you're not, having pregnant. Lifestyle factors, excessive drinking of alcohol, excessive tobacco smoking, using a hot tub very, very often, sitting on very hot seats every single time.
Hot tub.
Yes, those things can actually affect sperm production, because sperm production requires a certain temperature to, for it to work properly. And so if the testicles is not in that appropriate temperature or optimal temperature, it can affect sperm production. And then also weight increase. So a big
man.
Yes, a big man also will have issues with fertility as well, because once you're big, it's difficult to to release quality sperms. And then finally, there are also problems with when there are diseases like diabetes. That's notorious. Diabetes will cause the penis not to be erect, so you have erectile dysfunction. And then if there's injury to the spinal cord, if there's surgery around the penis, all these things can affect the male having to reproduce. There are other more extensive causes, but I will not go into them, like genetics and all that. Those are like second line things to look at. But there's something I would like to touch on, which causes about 20% of all infertilities, and it's called unexplained infertility.
Wow. Okay.
This is when a couple have tried everything. They've done all the tests, and you see this very often. They come to you and say, "Doctor, I've done all the tests. I've done this one. I've done the semen analysis. They've checked my tubes. They've checked my ovaries. They've checked my uterus. My husband is fine. I am fine, but still, we can't get pregnant." That is called unexplained infertility. No cause can be found. 1 in every 5 couples will have that as a cause of infertility. So in summary, these are the things that causes infertility, and I'm happy to talk about anyone if you have any questions about it.
Thank you so much. This is really enlightening. I like the way you've, so what we are saying is that it is both the male and the female. So what we see most times is the woman seeking the help. It could also be the man. So this is a joint venture, and you just must participate in this journey of getting it done. I mean, by seeking, help from medicine. Now, there's something you touched on briefly. I just want someone might have this as a question, because you talk about hyper or hypothyroidism being a cause, or an indirect cause of infertility in this case. What are the symptoms, and what are the symptoms that what are the things that someone can experience that will make them worry, okay, this could be it, I'm just want to enlighten, just briefly, just touch on that briefly, please.
Sure, don't briefly. So the thyroid gland modulates temperature, emotion, and then weight. It produces hormones called thyroxine and triiodothyronine. These are hormones produced by the thyroid gland. And what they do is, when it's in excess, it causes something called hyper. Hyper just means excessive, right? And so the ways to know that is, you see people who their eyes are bulging. Like you look at them, they have big eyeballs. People who have been normal before, all of a sudden their eyeballs begin to bulge. They become very, very restless. They have what we call tremors. They're always shaking like that. They sweat a lot. They begin to lose weight. When you see all these things in one person, please tell that person to go and check their thyroid, because that might be what they are having. The thyroid might be hyperactive. On the other hand, if it's hypoactive, meaning that it's not functioning the way it should function, you now have they sleep a lot, because if you're not hyperactive, you're sleeping, right? They sleep a lot, they snore, they become very big. right? Unlike hyper where they slim down, you become very big. They have mood changes, they have depression, they have things that would slow them down. So your whole system slows down. And then just imagine somebody who has a slow metabolic rate, who doesn't exercise and all that. They sleep a lot, they are big. That's a way to think about hypothyroidism. So those are the two extremes. So when you see people in any of those extremes, one of the things you have to advise them is they should go and seek help, because they might actually have thyroid.
Yeah. Okay. Thanks so much. That's really clear. So now we've talked about what infertility is. We've talked about, primary, secondary infertility, and then now we've explored the causes of infertility. Now, when would you advise? You touched on this briefly, but I wanted to elaborate a bit more. When would you advise couples to start seeking help? Because you said for certain people it could be immediately and all that. Let's assume it's a couple who just gotten married, they've explored that 12 months and stuff. Is that the point where they'll start seeking help, and what should they do if they notice that this is a thing?
Perfect. I will break this into 3 different pockets. The first pocket, you're a young man, a young woman, you're healthy, normal size, no issues. You should wait 1 year. Meet your partner regularly around your ovulation, at least 3 times a week around your ovulation. And if you don't conceive after 1 year, seek help. The second category is the woman who is above 40, right? So you're above 40 and you are trying to get pregnant. I wouldn't wait 1 year. Time is not on your side, right? Remember that by 47, 48, 49, 50, 51, 52, you could go into what we call menopause, meaning that once that period reaches, you will produce eggs, and you need eggs to get pregnant, right? So 40 and above, we would say 6 months. If at 6 months you don't get pregnant, please seek help. That's category 2. The third category is people who I would say seek help immediately, like something is wrong. And I give examples. For example, you're a man, and by the time you meet your partner for the first time, you have dysfunction. You cannot stand up. You cannot stand erect at all. That is the problem. You need to be erect to conceive naturally. If you're not erect, you cannot, right? The second is when you have diseases that have made this in a man now. Let's say this man had cancer before and was treated with either chemotherapy, radiation, or some kind of hormone. Let's say testosterone, right? So once they've done that, there's a chance that may be the reason why they're not having babies. So if you have that history, don't wait 6 months, don't wait 1 year, go in straight. Varicocele, you look at your testicles, you could see a bag of worms. You wait 1 month and you don't get pregnant, 2 months you don't get pregnant, please go seek help. That might be why you are not getting pregnant, right? Now, there are some infections that if you suffered in the past, your mom told you that you had something called mumps, MUMPS. It's an infection that if a man has, can literally blow out the testes, meaning that it could make the testes lose entire sperm production. So if you had that history as a child and your mom told you had mumps, please, not only will you be honest with your partner before you marry them, and you may, but you also need to check those things when you try the first, second time and you cannot get pregnant. And then finally is for in the male, something we call undecided testes. So the testes, you cannot feel your testes. You should be able to feel your testes as a man, either 1 or 2 of them. If you can't feel any of them at all, please seek help immediately, because that may be the reason why you're not getting pregnant by the first or the second one. For the woman, your cycles are very irregular. You see your period, let's say, only twice a year, right? That by itself is a problem. You don't have to wait for 6 months. Again, you need to ovulate. Part of the ways to know you're ovulating is, apart from the symptoms you see, or using a test kit, is that your period will come. You cannot have periods if you don't ovulate. You have to ovulate to have periods, right? So if you're having periods 2-3 times a year, don't wait. Begin to find the reason why you're not ovulating, right? If you have, like the man, you've had cancer before and you've been treated without preserving your eggs, either through chemotherapy, radiation, or hormonal therapy, or you've had surgery on your ovaries for, let's say, an ovarian cyst or something, and you're not getting pregnant immediately, seek help. So those are the people in the immediate category who don't wait for 6 months.
You need to wait for that long.
So that's how I always tell the patients. It's 1 year, 6 months immediate. And then whatever category you fit in, try to. And the other examples, these are just the commonest ones that I just listed for you.
Okay. Thank you so much. I'm getting blessed, actually. I'm really learning. Now, I just want to ask before we start exploring what are the medical interventions or, what are the treatment options, I want to ask this question. Are there practices that women engage in that can cause, or risk them being infertile later in the future? Are there certain things that they do early in life, maybe some kind of food, whatever, anything at all that they may think is healthy or something? Are there anything like that they should be aware of that can, predispose them to infertility?
Absolutely. And there are lots of them. And this is not just for the woman. There's also for the male as well.
Okay.
And from a general perspective, if anything that tampers with the way you perceive hygiene. Now, hygiene for the woman, when they want to clean up, some of them will go in and wash. So I'm talking about the private area right now, the vaginal area. They clean up so well, and sometimes even use perfumes on there, right? Trying to look good for their spouses and things like that. Now, that practice, it may feel good to you, but you're actually destroying some of the things that may actually help you get pregnant. God designed it that way. There's a lot of bacteria there. They do some work. They do work, that help to make the cervical mucus easier for the sperm to go in. So when you clean up like that, you distort that atmosphere. To have infections, right? Bacterial vaginosis, yeast infections. Those are the things that can happen when you do that. And when you start beginning to have infections, so it's a snowball effect from cleaning up to infections, and then from there, immunity is low. The infections will climb up to the uterus and can begin to cause problems. Diet, right? So when you're young, you want to eat a lot, you want to do all that. It's good, do that, but make sure you watch your weight, right? Because the bigger you get, I'm not saying people who are big don't get pregnant, don't get me wrong, is when you don't get pregnant when you're big, then you have to start thinking about why you're not getting pregnant. And one of the easiest things to do, I've seen it work several times, lose weight. If you lose weight by 10 to 20% of the time of your actual original weight, if you lose it by 10 to 20%, you will get pregnant. And then for the males as well, habits like drinking alcohol, smoking, things like that. Those are things that people do early in life that if they don't stop,
affects them later.
Find God, can affect them later in life. So it's more about lifestyle issues, things that we do in daily life that we think is nothing, that cumulatively those things can affect our fertility later in life. And so yeah.
Now, we're still exploring the medicine of fertility. What are the treatment options? What is available? Because this conversation is very important, because I remember my wife told me one day one of her friends called her. He said, I think that's what even motivated this episode. I would say one of her friends called her, and because she's been waiting for a while, I think for over 2 years or something, she's becoming worried, and then she was asking her that is this IVF or these are still reproductive techniques and stuff? Is there a contradiction of faith? That touched me personally. And I was like, wow. So certain people believe these things. I believe that science is an expression of the wisdom of God. You see, God supplied us this wisdom to be able to do certain things. Sometimes we there's a limit to it. That's why God steps in. But there are things we can actually do. And some certain couple right now, they've not even explored this option. They don't even know enough to do so. So my question is, what treatment options are available?
Yeah, and thanks, Dr. Mena. We would touch it all that in detail. The scriptural basis for why people think what they think, and I don't blame them.
Mm.
You will see why people have those notions, and then we will come from a science Christian background to try to bridge that gap, to say what's going on right now in the field and how God is helping us, and what, in my own opinion, I think people should do. So, going to treatment options. So, treatment options, I would divide it into four major parts. So, one is conservative way, so lifestyle changes, right? That's usually the first thing we tell couples, right? So, it might sound very simple. Trust me, it might sound very simple. The first thing is, are you meeting yourselves 3 times around your ovulation? That might be all you need, right? So if you're not doing that, please do that. Okay, you've done that around all the things we talked about and you're not getting pregnant. The next thing is other lifestyle issues. What's your weight like? Lose weight. If you're underweight, gain weight, right? So those things alone can fix it. Lifestyle changes, right? If you use, hopefully you don't, but if you use illicit drugs or you smoke, stop those things. If you are in something that causes you high stress, reduce stress, because those are things that can affect ovulation, like I said. And once ovulation is affected, it can cause infertility. And then treating medical disorders. We talked about thyroid, right? It works like magic. You have thyroid issues, you treat it, ovulation comes back, you get pregnant. Diabetes, your sugars are very high, you control it, you get pregnant. Your thyroid gland producing milk, you take the drugs, it stops, you get pregnant. So these things, you can restore your normal reproductive function by treating these disorders, then you get pregnant. So that's the first bucket, which is making sure you change your lifestyle and normalize your ovulation. The next bucket is what I would call ovulation induction. Now, sometimes when women do all these things and they don't get pregnant, sometimes we need to help them. They just need some help, some extra kick to get pregnant. And there are lots of things that we do for women. There's something called clomiphene citrate. The trade name is Clomid. We can use Clomid. It's an oral medication that we give, and it helps to block estrogen. So if you have a lot of estrogen, it blocks estrogen, and then it makes the pituitary gland to stimulate a lot of other hormones called FSH and LH. These are hormones that will help induce ovulation. So that is one. Another medication is called letrozole. Letrozole is also another drug that we use, and what this does is a drug you take. It lowers estrogen production, and once you do that, FSH will be released. Now, one common theme you can see is high estrogen, low progesterone. These are hormones in the body. You must have a balance of them. Before you ovulate, your estrogen has to reduce a little to allow you to ovulate, so that progesterone will begin to happen. So what these drugs do is they block that estrogen production or reduce it to allow you ovulate, and then you have ovulation. What are drugs that we use? The third category is the gonadotropins. So these are injections that most times people receive to help them ovulate, and there are several of them out there. There are FSH, LH injections, and they are called gonadotropins. They have different trade names. What they do is they bypass the brain, so they are injected and they go straight to the ovaries to cause your ovaries to ovulate. And then finally, there is a drug called metformin. Metformin is a popular drug, mostly used by
diabetes. Yeah, it's a diabetes medication.
Yes, mostly used by people who have diabetes, but for women who have a condition called polycystic ovarian syndrome, I talked about it initially. It's a disease of the ovaries where the ovaries have a lot of cysts in them. So those cysts will prevent the ovaries from ovulating. They form like a cement, a block around the ovaries. So what metformin does is metformin will make your body sensitive to insulin, because when this ovary does these things, coincidentally, what your body does is it produces insulin resistance. So what metformin does is it improves your body's way of responding to insulin, and that effect alone helps to restore ovulation. So that's the second category I talked about. The third category is surgery. So I talked about blocked tubes, right? Fibroids, endometriosis. For the men, varicocele, right? These are things that if you have, surgery can correct. We can go in there, fix the tubes, cut out the areas that are blocked, and reanastomose it, and you get pregnant. If it's a man, you have a varicocele, you can go there, remove it, and you impregnate your wife. If you have endometriosis, you can go there, remove the implants, adhesions, and all that, and then we improve your chances of getting pregnant. If you have fibroids, and those fibroids are huge, if they obstruct your tubes or they affect the lining of the endometrium where you implant the sperm on or the egg on, we go there, we take out those fibroids to improve the chances of conception. So that's the third category. The last, which is where most of the controversies about treating infertile patients come in, is what we call the assisted reproductive technologies. Before I talk about that, there is one other procedure. We don't lump it into assisted reproduction, but it's on its own. It's called intrauterine insemination. So this is a situation whereby we take out the sperm, so people ejaculate. We get the sperm, collect it, wash it, concentrate it, and then we'll place it directly into uterus around the time of ovulation. We use it when there is some kind of male infertility, when it's mild, or when there's unexplained infertility, like I talked about, or the cervix produces very thick mucus. Remember when I talked about what happens during ovulation to allow the sperm go in? The cervical mucus has to be thin. Some women have very thick mucus, so because of that, the sperm cannot go through. So they need help. We use that pipette to bypass that cervical mucus and then take them and drop it so that they can travel to meet the egg to fertilize. So that is intrauterine insemination, or called IUI. Then finally, which is the assisted reproductive techniques, there are a couple of them, but the commonest ones, there are two very common ones that you will hear about. One of them is called the in vitro fertilization, popularly known as IVF. Okay, what we do there is the process starts with, remember that I talked about a drug called gonadotropins initially. So we use those drugs to make the woman to ovulate. We give them in a way that she ovulates and produces a lot of eggs, right? So once those eggs are produced after we inject those drugs, then we go in with, it's a very sterile procedure. We go in and then aspirate the eggs from the ovaries, right? It's done surgically. We get those eggs, aspirate them, and then we store them. Then the man, he produces sperm. We get those sperms that he produces, get the woman's eggs, take them to the laboratory, to the lab, and then put the two together. So that we are trying to do what you would have done naturally outside. And when you fertilize those eggs, we take them and then put them back into the woman. And there are several reasons why we do this, but that is one of the ways in which people can get pregnant. The second way is something called intracytoplasmic sperm injection. The short form is called ICSI, I-C-S-I, intracytoplasmic sperm injection. This is used when in situations whereby the man has severe infertility. Sometimes some men, when they do their sperm analysis, we only can see maybe one or two sperms. That man cannot get pregnant with IVF. So you need to harvest that sperm, get one egg, and put that sperm directly into the egg. So IVF, you drop them close to each other, they find their way and fertilize. In ICSI, you take that sperm and put it directly into the egg. You don't want to take chances, right? Because you have very limited amount of sperm to use. The other reason why we do ICSI is when somebody has done IVF 2-3 times and it has failed, then you help them. You take the sperm and put it directly inside the egg.
Well, thank you everyone for joining us today. We hope you've been blessed. Join us again next week as we go further and consider and explore the mysteries of infertility. This is Doctors in Ministry. We're medical doctors and we believe in Jesus as our personal Lord and Savior who has given us life and peace. Jesus said one day, he said, "Come unto me, all you who are weary and are heavy laden, and I will give you rest." If you would like to give your heart to Christ today, please lay your right hand on your chest and say this prayer after me, wherever you are. Say, "Lord Jesus, I believe in you and I welcome you into my life. I believe you're the Son of God who paid the price for my sins. By faith, I receive you into my heart as my personal Lord and Savior. Today, I receive the life of Jesus Christ, and I declare that the powers of sin, Satan, hell, and the grave are broken over my life. Henceforth, I declare that my sins are forgiven. I am born again, and I'm a child of God. Amen." Well, if you just say this prayer, congratulations. I welcome you into the family of God. Kindly reach out to us. Send us an email at info@doctorsinministry.org. We'll be glad to connect with you and to share resources with you that will help you grow your faith. Thank you again, everyone, for joining us on today's episode. Until we come your way again next time, keep living in an atmosphere of faith. God bless you.